Clinical chemistry, markers of liver function. In this table, you can see various tests of hepatic function and what they're used to diagnose. So take a look at this table and we will talk about some of these in more detail. Aminotransferases. So aspartate aminotransferase is abbreviated AST and it's also called SGOT. There are cytoplasmic, mitochondrial, and macro isoforms. So the cytoplasmic isoform is released during liver damage. It's also found in skeletal muscle, kidney, and red blood cells. The mitochondrial isoform has a shorter half-life and greater heat stability. It's increased 15% with liver disease. Macro AST is complexed with Ig, an immunoglobulin, usually immunoglobulin G. Alanine aminotransferase is abbreviated ALT or SGPT. It's more specific for liver damage. It's present in the cytosol of hepatocytes, and the levels are lower than those of AST. It's not present in heart or skeletal muscle. AST is measured in the assessment of liver and biliary function, and also skeletal muscle damage. It's dramatically increased with viral hepatitis, liver hypoxia, or necrosis, and there's modest increases with autoimmune hepatitis, cholestasis, alcoholic liver disease, cirrhosis, and liver carcinoma. It's measured in serum or plasma that's free of hemolysis. EDTA, heparin, oxalate, citrate are acceptable anticoagulants. It's stable in frozen or refrigerated samples, and stability can be enhanced by adding P5P to the sample. It can also be measured in CSF and urine. ALT measurement, the de-Ritis ratio or AST to ALT ratio. AST to ALT is typically greater than 1, increased in cases of severe liver disease with necrosis, alcoholic hepatitis, cirrhosis, hepatocellular carcinoma, reflection of release of mitochondrial AST. It's less than 1 in inflammatory conditions like infectious hepatitis. Serum is the preferred sample. Heparinized or EDTA plasma is acceptable. It's stable for 3 days at room temperature and 1 week with refrigeration. This is a table diagramming ALT versus AST in various disease states. So please take a look at this table, review it, and know what might cause one to increase or one to kind of have no effect and how much it would increase. Alkaline phosphatase, so ALP, it's differentiation of bone versus hepatobiliary disorders. ALP expression is induced by cholestasis. Elevations are more marked with extrahepatic obstruction, greater than 3-fold by a stone or cancer at the head of the pancreas. The degree of elevation is proportional to the extent of the obstruction. It's also elevated with intrahepatic biliary obstruction, 2 to 3-fold, by cancer or drugs. There's a modest increase observed in liver disease affecting parenchymal cells. Less than 3-fold may be normal. Infectious hepatitis, and it will be higher if damage is associated with a canaliculi or biliary stasis. GGT originates from the hepatobiliary system. It's elevated in all forms of liver disease. Highest elevations with intrahepatic or posthepatic biliary obstruction, so it's 5 to 50 times normal. High levels are also observed with neoplasms and pancreatitis. Moderate elevations are seen with infectious hepatitis, fatty liver disease, alcohol, or drug intoxication. Urine GGT is usually indicative of kidney source, elevated with acute renal infection and renal tissue destruction. It's depressed with chronic renal disease. Other liver function tests include prothrombin time. It's used to distinguish cholestasis and severe hepatocellular disease. If PT is long, you want to repeat measurement after vitamin K injection, and then you repeat it after 4 hours. If it's corrected, the patient has cholestasis. If the prothrombin time remains long, the patient has severe hepatocellular disease. Urea and ammonia are increased. You have increased ammonia in infants and children. Hyperalimentation syndrome or hyperalimentation Reyes syndrome. It's infrequently due to congenital defects in the urea cycle. Increased ammonia in adults is observed in terminal stages of liver cirrhosis, hepatic failure, acute and subacute liver failure. Decreased serum nitrogen in cases of liver disease without renal impairment. So talking a little bit more specifically about obstructive liver disease. So if alkaline phosphatase is increased, you want to confirm GGT. If it's not increased, it could be possibly a bone disease. If it is increased, it could be obstructive liver disease, and you would need to do imaging in order to determine that. Looking at these flow charts and having these memorized when you go into taking not only this test that's coming up for our class, but also for your qualifying exam is going to be important. Today, I still reference these sheets to look at blood results when I'm evaluating different types of results that I receive questions about. So if there's abnormal liver function tests, I'm just going to click through this to present all of it. And this is another flowchart that I like to use. You want to look at AST and ALP. So if we have AST is greater than 3 times what's normal and ALP is less than 2 times what's normal, it could be hepatocellular disease. Then you want to look at albumin. If albumin is normal, it could be acute hepatitis. If albumin is decreased, it could be chronic hepatitis. If AST is less than 3 times what's normal and ALP is greater than 2 times what's normal, it could be cholestatic disease or cholestatic disease. You measure albumin. If albumin is normal, it could be acute cholestasis. If albumin is decreased, it could be chronic cholestasis. Either way, you want to do diagnostic imaging to confirm. And then intrahepatic versus extrahepatic cholestasis can be distinguished by diagnostic imaging. This is another table that shows some of the markers that we've already discussed and what happens in each one of the patient conditions. So take a look at this table, read it, internalize it, know it. Questions specifically off of this table could come up on the test. And this shows obstructive jaundice versus acute alcoholic hepatitis and some of the markers. For this graph, you don't need to know the details about it. This is just something kind of interesting to look at. And you can see graphs of different levels of these. These are in days, these are in weeks. So you can take a look at this chart.